Thank you very much for this opportunity to talk about our recent paper in gastrointestinal endoscopy. My name is Michael Wallace. I'm the Chief of Gastroenterology and Hepatology at the Mayo Clinic in Jacksonville, Florida. The paper presented in this journal evaluates the impact of fellows during colonoscopy. As many of us in academic medical centers know, a key part of our role is to train fellows in endoscopic as well as clinical skills. It's our pleasure to present this data because it has very important implications for how we perform colonoscopy, particularly in academic medical centers. As many of you know, the quality of colonoscopy has become a very important topic of research and clinical care. Colonoscopy remains a superb way to prevent colorectal cancer, but like all tests, it's not perfect. We and many others have looked at ways to measure how we can improve quality in colonoscopy. Particularly in academic medical centers, one of the concerns we've always had is whether the presence of a fellow during training, a fellow in training doing procedures, has either a positive or negative impact on the quality of colonoscopy. Many patients often ask if a fellow or trainee will be involved in their particular procedure. And we've often wanted to know for sure, does this improve or potentially even decrease quality? In this study of over 2,400 colonoscopies performed at our center at the Mayo Clinic in Florida, we evaluated the adenoma detection rate during colonoscopies performed either with a fellow or without a fellow. A little over 300 of these 2,400 colonoscopies was performed with a trainee. We were very pleased to see that even with our generally baseline high adenoma detection rate in routine colonoscopies, we had an even higher rate of adenoma detection during procedures when a fellow was present. As you all know, adenoma detection rate has become the main measure of quality in colonoscopy. It's been linked to subsequent development of colorectal cancer, such that doctors who have high adenoma detection rates, their patients are less likely to develop colorectal cancer in the next 5 to 10 years. This study has some important implications for practice and particularly in training centers such as ours. First, we can reassure our patients that when a fellow is involved in their care, that they continue to receive the best possible quality of care, and certainly it is not diminished in any way. And so our patients can feel reassured. Secondly, it tells us that one of the possible ways we can improve the quality of colonoscopy is to involve teaching. There are several ways this may occur. One is simply having more people looking at the screen. We know that even involving experienced nurses has been shown to increase adenoma detection rate in other studies. So it may simply be an extra pair of eyes looking at the screen. But also the actual performance of teaching often inspires us to be better doctors. We try to set a good example for our students and fellows doing the best possible job. And I think teaching, and particularly teaching fellows in endoscopy, brings out the best in us. And I think it's an important lesson for all of us doing colonoscopy that we should practice what we teach. And when we teach a fellow to look very carefully behind folds, to wash the colon well, to look carefully for subtle polyps, we should practice those in everyday practice with or without a fellow. So in summary, I think this study provides some important information for us as to how to continue to improve the quality of colonoscopy from an already excellent state to one that's even better. It has important implications for training fellows and reassuring our patients that they're getting excellent care even when a fellow is involved in performing the procedure. Thank you very much.